we are no longer have a need to follow them. We do still continue to follow a few of them. We've had a small number of people, less than 10 people, who had some type of symptoms that prompted us to test them for coronavirus. All the coronavirus tests that we have ordered are negative. We have all the tests back at this point on all the people that have been tested. We have no more outstanding tests at this time that we're awaiting results on. So we feel very comfortable at this time to say that we don't have the disease circulating in our communities. Remember that there are over 60 countries that have reported cases. There are almost 90,000 people in the world have reported infections that we know about, but the disease is still not widely circulating in the United States at this time. There are some episodes of community transmission that you have undoubtedly seen in the press on the West Coast and in the Northeast, but at this time this is not a high risk for people who live in Alabama. We will continue to monitor. Situations can change quickly, but at this time we do not see a highly elevated level of risk for people in our state. I would finally ask you to remember what you can do to prevent coronavirus transmission. In many ways, this is exactly the same advice that we give out every year during flu season. The way we prevent these type of respiratory transmitted diseases from spreading is to, first of all, use good hygiene. Wash your hands frequently. Avoid touching your eyes and nose and mouth with your hands unless you wash carefully. We would encourage you to cover your cough or sneeze if you have a cough or a sneeze. Stay away from people who are ill. If you know that people who are ill, then do your best to try to avoid that situation. And I can't stress this enough, but if you yourself are sick, please stay home. Please don't try to work through an illness. Don't try to go to work or go to school, but stay home until you're well enough to get back out in public. That's all the prepared comments I had right now. I'm going to turn it over at this time to Dr. Don Williamson from the Alabama Hospital Association.
Scott, thank you. Let me first start by thanking the Alabama Department of Public Health for working with our hospitals to keep us in the information loop and helping us to remain prepared. Now, let me point out to start with that emergency preparedness and responses are not new. Our hospitals have emergency preparedness plans that they exercise on a regular basis. We have developed processes to screen and to isolate individuals who present to the hospitals meeting the CDC criteria for the virus. In addition, we're working to ensure that the employees of our hospitals that will be essential in response are adequately trained and prepared so that they don't risk acquiring infection. Hospitals treat patients with infectious diseases on a daily basis. These patients are isolated, they're treated in appropriate spaces by trained personnel, and when there is a threat of a disease that could cause a surge of patients, each individual hospital steps up its preparedness and coordination activities. Hospitals share best practices, and they also deploy specific strategies that will work best in their facilities and to contain any outbreak. Much remains unknown about COVID-19, but a clearer picture is emerging, and hospitals are refining their responses regularly based on that additional information. What do we know now? We now know that most people who become infected with COVID-19 will not become seriously ill and will therefore not need hospitalization. However, we are able to quantify bed availability in near real time and to implement surge plans to increase available beds should that become necessary. Those systems have been well tested in previous hurricanes and during previous flu seasons. I would just close again by thanking the Alabama Department of Public Health and by reiterating the comments that Dr. Harris made. It is still flu season. If you've not been vaccinated, be vaccinated. Not that it will protect you against COVID-19, but because it will lessen the confusion if you develop a flu-like illness. Practice hand washing. Don't touch your face with your hands. Surgical masks are only effective for people who are symptomatic to try to prevent spread from them. N95 masks are only effective if they're properly fitted, so masks really have no place for the general public in trying to control exposure. So again, thank you, and I answer any questions.
Thanks for the invite today, Dr. Harris. My name is Director Brian Hastings. I'm the Director of the Alabama Emergency Management Agency, and I'm thankful for this time just to talk about a couple of points that I wanted to bring up. First of all, the Alabama Emergency Management Agency is not the medical or public health league. Dr. Scott Harris and his team at Alabama Department of Public Health are the medical and public health leads in Alabama. The Alabama Emergency Management Agency is the lead coordinator for requests and response across the state and outside the state to the state of Alabama and assistance from the federal government. So we are here to support the Alabama Department of Public Health and our public health officer, Scott Harris, in the Alabama activities to make sure that we respond and recover from the COVID-19 outbreak. We're very fortunate, like Dr. Harris said, that we don't have any cases here. And as our speakers have already said, we've had some experience with this in the past. So this is a very serious situation, but it shouldn't be filled with a lot of fear. We need to make sure that we're thinking through this and looking at the facts. We've done this before with pandemic influenza. We've seen it with some Zika, and we've also done it with Ebola here in Alabama. So we can't forget what we've done in the past. It's time to kind of recreate those good habits that have kept Alabama healthy over the years. I'd like to reiterate that not only is the flu good for reducing the confusion, but if we are vaccinating ourselves and staying healthy, then we're also not using resources that could be dedicated and prioritized to the COVID-19 outbreak. The other thing is worth repeating, and it's so hard to do, is that there are two people who will make the difference in a disease containment exercise or an execution of a disease containment plan. It's you and everyone else around you. So if you or the people around you are unwilling to wash their hands, practice good personal hygiene, cover your cough, don't touch your face. If you do those things, you need to wash your hands. You need to sanitize your workspaces once in a while. Good personal, professional, and social hygiene is key. And if you're feeling sick, go to the doctor. And if people around you are sick, don't hang out with them. Practice social isolation, social distancing when you need to, and I think that will help Alabama stay healthy through this episode. Thank you very much. I appreciate it. Thanks, Scott.
We haven't answered any questions at this time, if we haven't.
Nationally, there's been a conversation over the weekend about the testing, the lack of test, access to testing. Can you walk us through Alabama's availability to testing and how that's being done across the state?
Sure, absolutely. So for those of you who couldn't hear, the question was about testing for coronavirus. Alabama has received tests from CDC. We received them recently, and as you may recall, at the national level, there were some questions about quality control, and it appears that not to get into technical of an explanation, but it appears that there was really just a single reagent problem with a single part of the test. And we have now received the go-ahead to begin using those tests that we have received. We're in the process of training our staff and doing that now, and making sure our quality control is correct in the way it should be. And so we expect to be testing very soon. I don't know exactly, but we have the test and are actively training and should be doing that promptly.
For those at home, if they come in contact with someone who's traveled to an area that may be on the map with this outbreak, do they need to be tested, or do you need to wait until you have symptoms to be tested?
The best guidance that we have right now is that people coming from parts of the world where there may be a disease need to self-monitor. We have tried to coordinate our message very closely with businesses, with schools, and with others who are seeing these travelers. And there's a lot of good information that we try to make sure these people get and understand about how they can practice social distancing, how they can monitor themselves for illness, and there's no need at all for them to be tested without symptoms at all. Even in the case that they have symptoms, we would certainly ask them to contact their healthcare provider or to contact us, and we can provide more information about that. But at this time, most of those people are not likely going to need testing. Other questions?
Dr. Harris, we have a few via email. When it comes to disinfectants, like the Clorox and Lysol wipes that we use. This individual wants to know, are those beneficial when it comes to killing the bacteria associated with COVID-19?
Yeah, the question has to do with appropriate disinfectants to use for the virus that causes COVID-19. This is a new virus, and so we can't say for certain. However, there is a lot of experience with coronaviruses, and routine disinfectants do appear to be effective in almost all cases. CDC actually on their website has really extensive information for cleaning crews or people that are doing disinfecting of healthcare facilities or workspaces. And I'll be glad to refer you to that link once we finish here today. We can get back with that person. But it's actually very standard cleaning techniques. There are no real special disinfectants that are required to the best of our knowledge.
And what is the status, if we know, of a vaccine for the virus?
The question has to do with the status of a vaccine. I actually just returned from a meeting with CDC people over the past few days. There is good progress being made in developing a vaccine. It's possible that it can be tested on people in the next 2 to 3 months. Probably not before that, although that's actually an amazingly fast turnaround time when we think about vaccines for other diseases. The best information I have received is that it still might be a year or more before it would be widely available for people. So it's not going to be imminent. Although again, I would say even having a vaccine in a year for a disease we didn't know about 4 months ago is pretty remarkable. Yes?
Susan, could you talk a little bit about how the hospitals are preparing? We had the nurses union on the West Coast came out with a pretty strong statement this weekend. How can we avoid that in Alabama?
Well, again, hospitals, this isn't, as you've heard, this is the first time we've done this. H1N1 was a pandemic. Fortunately, it turned out to be a very low death rate. But so right now, you've got to prepare your workforce. In Italy, one of the challenges they're facing in Italy is that 10% of their healthcare workers are infected. So that reduces the number of people able to provide care. So making sure that your frontline personnel are trained on personal protective equipment so that they don't get infected. Then you got to set aside separate rooms in the hospital and try to funnel people who may be at risk through a single point of entry, through a single point of screening into those rooms so that appropriate testing and triage can occur. And then for those small number of people who end up needing to be hospitalized, it's about putting them in appropriate isolation, using appropriate personal protective equipment to minimize spread in the healthcare facility and minimize spread to healthcare workers. I mean, one of the most important things I think going forward is going to be to protect the healthcare workforce so that they are there and available to provide care. That's why inappropriate use of masks becomes so problematic. We've got to keep that personal protective equipment available to the healthcare workforce so that we can protect them, so that we don't find ourselves with healthcare workers inappropriately exposed. At this point, you know, we've got plans. We work those plans on an annual basis. We've got surge capacity. We've got surge plans that we can increase beds. We can working with public health and with the emergency management agency. We can move ventilators or respirators should that be necessary. Right now, there's obviously no reason to even consider that, but we have the capacity to respond if we need to. Again, as Dr. Harris has pointed out, social distancing to buy us time for good antivirals becomes extremely important in this setting.
Further questions? If there are no further questions, again, let me thank you for joining us today. The message that we would like the people of Alabama to understand is that we understand the concerns that you have. We feel that Alabama is prepared to deal with this. We will continue our prevention activities, and if we see disease in our community, we'll be ready to respond to that. Thank you very much for joining us today.
Can y'all hear me? So good morning. We were rushed a few minutes ago for them to get started, but again.
In news now, I'm Eric Reynolds, and you've been listening in to the Alabama Department of Public Health news conference today. We're also going to head now out to the Mobile County Emergency Management Agency, which is also holding a joint conference in response to the word from Montgomery. Let's listen in there.
Just to give you a very quick recap before I turn it over to our friends at the Mobile County Health Department. So, Brian Hastings, the director of Alabama EMA, is the person that we coordinate directly with to get resources that come from outside the county. So the things that you maybe know or don't know that are going on all the time around here: emergency support function 8, public health and medical services. We work very closely with the health department on that. And we also have a healthcare coalition, and there's many members of it sitting in the room today that meet on a monthly, sometimes more than a monthly basis, to coordinate health-related issues. So there's always some variation of work going on in this field, whether we have something happening or not. And, they mentioned some of the past pandemic type events. So we've been through some of these. We've got, some things we've done. We just got to continue to be vigilant. So just like we're the county emergency management agency, we have our own health officer here, Dr. Bernard Eichel. Many of you know Dr. Eichel, and he's got a team of folks that are here today. So they are through with their portion of it. So the team here will probably field any local questions that you might have. And again, we work with them. We're here to support them from the emergency preparedness standpoint. His team down there at the county are the medical professionals. So they're the ones that we all need to be looking to when it comes to the medical questions. So who wants to go first, Aaron or?
Good morning, everyone. I'm Erin Coker. I'm the Emergency Preparedness Coordinator for Mobile County. I'm housed at the location at Cox and St. Stephen Street. I'm also the Healthcare Coalition Coordinator for Mobile County, so most of you see me or get multiple emails and phone calls from me on a daily basis. I'm one of the co-leads for this, along with many other things that we have going on right now, but we just wanted to pull everybody together today so that we can take any questions that you may have, ease your fears, let you know that we are planning, we are working. We've been on so many conference calls, I think, about coronavirus in the last couple of weeks. It's more than we can count. But if anybody has any questions, this is Dr. Wendy Murphy. She's the epidemiologist at the Mobile County Health Department. She's also director for Bureau of Disease Surveillance and Environmental Services. So she's a subject matter expert on this as well. So we will take any questions or any comments that you may have at this time.
Hey, I'm Chris Perry with the infirmary. Can you hear me okay? The question is about asking travel questions, whether it's at clinics or at the emergency departments or at any intake. Is that something that y'all are recommending? Is that a travel question be asked, whether or not they're symptomatic?
Yes. Ask the travel questions. But the number of countries where there's widespread community outbreak is growing every day. So I think right now we're up to maybe 6 or 8 countries that have a low number. So CDC has changed the way that they're classifying countries. And so now there's a 3-category risk assessment for countries: widespread, sustained, sustained, ongoing, limited community transmission. So it changes every day. So there are 60 countries that have cases, but the ones that there are travel restrictions on are China and Iran, South Korea, Italy, Japan, and Hong Kong. But that's going to grow as we continue to see widespread transmission. And again, the point of screening is when folks are calling, or maybe before they enter the healthcare system, right? Like folks that have traveled, if they spike a fever or get a cough, we don't want them coming to the healthcare setting. We want them to stay where they are and quarantine themselves and call their healthcare provider ahead to see if they need to come in for treatment or to be evaluated. CDC over the weekend, late last week, changed their criteria for testing. And so at this point, the only people that they are testing are folks that are sick enough to be hospitalized. They're not testing, a traveler from Italy that might have a cough. So that's a big change that we've seen recently, that we're still sort of trying to figure out sort of what all that means.
Yeah, I know every case is different, but say a scenario, at some point, let's say we're gonna get something, there's gonna be a presumptive positive showing up at the doctor's office or school or something, and what happens at that point? Is that person sent to a quarantine, say in USA, or if you get your first presumptive positive, kind of take us through a scenario.
So, thank you, Steve. So, right now, as it stands, the only people that would qualify for testing are folks that are sick enough to be hospitalized. Okay, so they would be cared for in an isolation unit in a healthcare setting with, nurses and other physicians and clinicians that have, been trained in donning and wearing proper personal protective equipment. Right now, we're not testing people who may have traveled back and, like I said, have a cough but are well enough to go to school or church or work. So the recommendation is that if you have traveled and you spike a fever or have a cough, you need to stay at home and self-monitor and restrict your movement so that you're not out in the community potentially spreading the virus. It's going to be tough for us to identify when those milder infections are occurring and when the coronavirus is being transmitted in the community, but causing mild infection, because right now we're not authorized to test those people. So that's why we keep saying it's the same recommendations that we have for every flu season. If you have a fever and a cough, stay at home, isolate, wash your hands, don't go back to work or church or school until you're well. So this is going to put people in a situation of having to sort of decide, do I, if I can't go to work for 2 weeks, does my kid still go to school, or do I keep them home from school, that sort of thing. So largely we'll have to deal with this sort of on a case-by-case basis, but it's primarily in the hands of businesses and schools and churches to sort of dust off their plans for, increasing disinfectant, for encouraging, different practices. We may have to change masks at some churches, or we have to go from handshaking to elbow bumping or something of that nature.
Is self-isolation time 14 days, or is that the time frame?
So 14 days is the incubation period, right? So from the time that you're potentially exposed, that you should start to have symptoms, if you're going to have symptoms, within 14 days. I think what you might be getting to is people ask us all the time, how long does the sickness last, right? If you have a mild illness, it could be just a couple of days. If you're seriously ill requiring a hospital stay, it could be 10 or 14 days. Sorry.
So let's say the results of the test come back positive. What's going to be the protocol for government agencies, organizations, and businesses? Are we going to isolate that particular location, or since they were involved?
No, the answer is no. So if someone at a hospital is tested and the test is positive, then there will be a lot of work to try to identify who that person had close contact with. But it does not automatically translate to, wing of the hospital being shut down or anything like that. Because once they're in a hospital, they should be under infection control practices. And if not, then we'll identify, work with the hospital and with state public health and CDC to identify who that person has come in contact with. Does that make sense?
So if they've been working at a location, then they become sick. Do you go to the location?
Yes, so we can notify the folks that are close contacts and give them some instruction about monitoring for their checking their temperature twice a day, and that sort of go through that process of monitoring them until they get out of that 14-day window. Yeah.
How long can the virus live outside the body?
So I'm not sure anyone knows for sure, or if they have, it's probably in the literature someplace, but most viruses that cause respiratory infections can last a short length of time on surfaces, a couple of hours to a couple of days if it's hepatitis A. But yeah, but that's why we're trying to just increase your disinfection protocol. Yes, sir.
Okay, earlier you talked about plans for churches and schools. Have y'all had any, gotten in contact with any of the school systems here in Mobile County about contingency plans in case there, God forbid, it's a case of infection?
So Scott Harris, the state health officer, mentioned there is a letter that has gone out to schools that is available on the ADPH website. So we fall in line with that guidance once it goes out because they are following CDC. Aaron might be able to speak to preparedness activities around schools and that sort of thing. Honestly, it would be the school's decision, just like if they close for a school day, for a snow day or during a high flu season or something like that. We don't generally close schools. Generally, that is a school board decision.
I know some of the larger entertainment venues, stuff like that, coming up on spring break. We don't currently have any confirmed cases in the state of Alabama, but there's a lot of travel coming in from other states. And on my news feeds coming in lately, it says that some event capacities have been limited in some states where there's a greater concern of spreading of the virus. Is there any type of plan in the states of Alabama limiting event capacities at this time?
Not at this time.
Not at this time, there's not. That's gonna be an event-based decision. I know you're talking about spring break and all that fun stuff, but at this time, there's no plans to limit who can come into the state and where they can go or anything like that. 'Cause we can't stop travel, they can drive across the state line in a matter of minutes, so.
Yes, ma'am.
So Spring Hill closing their facility over in Italy and those students coming back, are there plans to monitor those students?
When they arrive, we will probably let them do a self-monitoring or get with their student health and let them do a self-monitoring, and public health will just check in with them daily to make sure that none of the students are exhibiting any signs and symptoms. And if they are, just making sure that they know that they need to quarantine them for at least the 14 days from the time that they were exposed.
Okay, but y'all plan on being in contact with those students that are coming back?
The state health department is the lead in the state for conducting monitoring when travelers are identified. What the state is posturing for is to try to get schools and businesses that have an occupational health component to get those schools and businesses to monitor their employees or students. And then they will just sort of, liaise with the state health department. It's happening. So we're just trying to remind folks that, it's not time for panic or, stigmatizing people who have traveled. I think out of an abundance of caution, the universities are bringing people back and businesses are bringing people back. We know that they are, and as that list of countries with widespread community transmission grows and grows and grows, we're not going to know about everybody that's coming back from those countries. And so that's why we just keep sort of broadly messaging about be smart if you're traveling, right? If you come back, be smart. Help us protect your community by staying at home.
Has it been confirmed that the fatalities have all been elderly?
So in China, the average age of the people who have died is like around 70 or something like that. The two deaths in the U.S. was a 50-year-old and a 70-year-old, I think, but they both had underlying medical conditions. So it does seem that we're not seeing a disproportionate, number of illnesses in young, healthy people. It seems to be sort of, along the lines of influenza, that it's older folks and those who have other existing medical conditions. Aaron's whispering in my ear over here about what? No, that's okay. Somebody back there. Yeah.
Is there any indications on when the testing is going to be more widespread, not restricted to just severely ill?
No. CDC had a little bit of a stumble in getting the test out, and that's all been cleared, and so now they're, sending test kits out. You've probably been seeing in the news, you're getting a lot of test results out of California. They got some good tests and have been able to test more there than many other jurisdictions, but the state lab in Montgomery is the only place in Alabama that we know of so far that's going to be able to conduct the testing. There is some talk by CDC about maybe getting the test out to some large academic hospitals, but we haven't been told anything if any of the university medical centers, across the state are gonna be a part of that. Probably is not a high priority since Alabama doesn't have any cases. And, CDC has made the information available to private companies who are probably lots of them out there trying to work a test. But it'll be similar to what we saw with Zika when that outbreak happened, where it was just government agencies in the beginning, and then after months went by, then we started seeing commercial tests become available. I'm sorry. Yeah. So I just wanted to, this is something we've been sort of trying to educate folks on. You might see on social media or hear something that, oh, my kid tested positive for coronavirus. And, it says on the back of my Lysol wipes that it kills coronavirus, so why was this such a big deal? So there have been coronaviruses circulating since the 60s. There are 4 major types that circulate every year, and they cause the common cold. This one's different, right? There have been 3 different or new novel coronaviruses in our generation. So the one that caused SARS, severe acute respiratory syndrome, the one that caused MERS, Middle Eastern respiratory syndrome, and now this one that causes COVID-19. So if you see someone in Alabama tested positive for coronavirus and it's not coming from the state health department, it's probably one of those that just circulates year round.
Any other questions, comments?
Maybe we can get some input from you guys. How are your employees, especially if you're EMS or healthcare, you're checking your supply chain, you're checking your contingent plans for should you have staff shortages, everybody working on that at their agencies? If not, you should be.
It's time to pull out your pan flu plans and look at them, revise them, check inventory. That's a part of what public health and ESF 8's here for. We're more than happy to help you go through that. We're more than happy to provide training and education on what we can. So just let us know.
And before we leave, I just want to recognize Dr. Crawford is here, Stephanie Crawford. Many of you may know her from some of her time. She's now the Executive Director of Prevention and Wellness at the Health Department, so Dr. Eichelt's right hand. So if any of the county or municipality leaders that are here today want to sort of talk at more sort of an executive leadership level, she's here to answer some of those questions if you have them.
Hey, so let me just add, there were several questions about how the word is getting out. So today in the room, there are representatives from the county commission, the city of Mobile, some of the other municipalities in Mobile County Public Schools, and there might be some of our other. Everyone that we deal with from the extended EMA family got an invite, and they also get, when we push out information that we get from the health department. So there's a lot of people in the room today that are here to seek information to go back to their organization so they can nail their plan down, what it's gonna, what they're gonna do and how they're gonna do it. So, unlike if it was a tropical storm or a hurricane where we kind of lead the charge, with this really being a health issue, we look to our good friends over at the health department to kind of guide us down that path. So we're very thankful that Dr. Eicheldt makes his staff available and helps us through this process. So I'll be quiet, Aaron, and turn it back over to you.
Let me just add one thing. Stephanie just reminded me, someone was asking about mass gatherings. One of the things that Stephanie had been working with the city for a while, and finally this year we were able to lead some of the Mardi Gras parades to hand out hand sanitizer, just to try to raise awareness about the importance of hand washing. In addition to the coronavirus threat, we also have a hepatitis A outbreak going on in Mobile County right now. So hand washing is important. So we will try to do more things at large events to try to get the message out there about the importance of hand washing and disinfecting surfaces and that sort of thing. So you all can help us. You can be a force multiplier. Try to put messages out and hand sanitizer out in your agencies and institutions to try to, like I said, raise awareness about hand washing and maybe fist bumping or elbow greeting instead of shaking hands. Thank y'all for being here.
Yeah. Thank you for coming. If you go back and you decide that you have additional questions, you can email Mike and he'll get them to me, or I have cards with me. If you want to get some of my cards, we'll be more than happy to get some of your questions answered. If you didn't, please make sure that you sign in and grab a hand sanitizer that's back there. EMA needs to make sure that they have everybody accounted for that was here. Thank you again for taking the time out of your day to come out here with us. And like I said, if you have any additional questions once you get back, please don't hesitate to ask us.
We've been listening in to the news conference there at the Mobile County Emergency Agency out on Ziegler Road, along with officials from the Mobile County Public Health Department, and giving us an update on the coronavirus in both our area and the state. And the good news is right now, no reports in Mobile County or the state of Alabama. Our Steve Alexander is live out there at the news conference we all just listened to, and we're going to join him shortly for a wrap-up of what has taken place there. But as you got a chance to hear the information, many of the victims who are deceased due to the coronavirus are averaging about 70 years of age in China. And the ones, we have 2 in America so far, in the United States and Washington State, the age of over 50 and the age of over 70. We hope to check in here shortly with Steve Alexander, who is live there at the conference. Now, a couple of things that they did go over and talk about, recommendations. You heard a lot about hand sanitizer and washing your hands. There are still, that's the basic information. I think we're going to join Steve here in just a moment, along with Mark Harris. Let's check in here and see if we have Mark Bryant. We can check in. Let's see what's going on here. Stand by.
Eric, can you hear me?
All right,
I'm,
Steve, we have you on.
if
Go ahead. You have
now.
Mark Bryant there. Can you hear me okay?
No, Mark Bryant left. I'll see if we can find him in just a second.
All right.
Might be able to call him. I think so, yeah. Just to kind of, while we're waiting for Mark, just kind of get a recap of what they've said. Again, no cases, again, confirmed here in Mobile or in Alabama.
Okay, Steve, we've got you. Go ahead.
I'm having trouble cut off.
I know the cell service is.
Okay, Steve, we still have you on, so go ahead and give us that update if you can hear us.
Yeah, just to give you, we're going to probably have to move because the cell service is bad. Our IFB signal just cut out, and it's probably going to likely do it again. But let me do that before it cuts off again. Again, no cases, just to highlight if you've been watching. They continue to monitor, of course, we're in daily contact with the CDC. One of the terms that we might be hearing a lot more about in recent weeks is social distancing and even social isolation. And that's something that they're recommending that people who may have some concern that someone does have coronavirus, again, no confirmed cases in Mobile, that they check their temperatures within about a 14-day period, see if there are some kinds of symptoms. Again, all tests have been negative, they say so far. But again, it's going to be what happens when an actual presumptive positive is very often what it calls it, appears in the Mobile area. What happens at that point? Because there are no test kits here in Mobile, and if you listen to the news conference, it doesn't seem that there will be any test kits coming at any particular time in Mobile. All of them will be sent in Montgomery. It's going to have to be a case where it's watching, calling your doctor, and then hospitals, of course, will apparently make the final check as to whether or not there may be a presumptive positive. But what happens at that point? There are isolation units, and the hospital health department officials say, and of course the health department will get out, they say, any information about any presumptive positive cases. But again, it's not a case where I think all of a sudden you see a presumptive positive, from what I understand from them, and everything, you immediately start seeing people in suits and everything along that way. So we're going to get Dr. Randy Murphy with us just to highlight some of the things. First of all, let me get you to sum up the important points, kind of what you all said for people. We're on News Now, a feed too.
Yeah, so the important thing for people in Alabama is we do not have any cases of the novel coronavirus in Alabama. We have monitored, when I say we, the state health department has monitored about 100 people who had traveled. A few of those were tested, but they were all negative. So that's the good news, is that we still don't have any cases. A couple of the other sort of important points or things that maybe have changed is that the number of countries with widespread community transmission is going up almost every day. And so whereas travelers from China are still being routed through those 11 airports, travelers from these other countries are not going through that same process. So we're going to have travelers coming back to the United States and to Alabama that have traveled to to some of those countries. And it's flu season. So if they've traveled and they get sick with a febrile illness, then they're going to be concerned. And so we're just trying to remind people the same things we say for flu are right for coronavirus. If you have a fever and shortness of breath, stay at home until you feel better. Isolate yourself, and if you're just in the general community and you're concerned about what you can do, protect yourself by washing your hands, disinfecting surfaces, 6 feet. Arms length will protect you from the virus. So if you're around people who are coughing, try to stand away so that you're not exposed to those droplets.
Two more things to clear up for me. You answered this, and I guess I'm just not still a little confused. If at some point, if we do get a presumptive positive, is it something somebody's at home saying, boy, this my relative is having these kind of symptoms, a doctor feels that? I mean, again, what happens to that person? Do they say, stay here and stay at home, and then we send the test to Montgomery, or kind of take me through that?
Yeah, so if you have traveled and you're sick, we're going to tell you to stay at home. That person would not qualify for testing the way it stands now. We're only testing people who are sick enough to be hospitalized. So if you're older or have an underlying condition and you get a respiratory infection, it may require support at the hospital. And in that situation, then we might authorize testing for that individual. But the course of action is the same. You stay in the hospital or you stay at home until you're well. So if you're at home and you're not sick enough to go to the hospital, stay at home.
And unless you've traveled, they're not going to be testing people for corona.
No, it will be an extremely rare situation that CDC would authorize testing was for someone who was sick that had not traveled.
And this is the other thing. Any idea if we're ever going to get any test kits here in Mobile?
So in Mobile, probably not anytime soon, because the state laboratory in Montgomery is certified by CDC to perform some of the tests that they're sending, but I don't think we have that same level of certification at the Mobile lab. So, but stay tuned on that. Things might change.
Okay. Thank you very much for joining us again after the news conference. And again, you've heard a lot about what has come out of the news conference, and I can highlight some of the other points, and then Eric, if you had any questions. But again, you heard from also state health officials as well as Mobile County health officials on this issue, and it's still a work in progress. There have been a lot of certainly a lot of precautions, and going through the interestingly enough, the Ebola scare a few years ago has helped kind of got a protocol for hospitals to work with. So again, that has helped in past history. Eric, anything that you wanted to add or question?
Yes, Steve, if you would address the issue about the schools and some of the dialogue that took place in the news conference in reference to who decides if a school needs to close down, and the concerns of where we really aren't that concerned about that being an issue at this time.
No, they aren't. They've communicated with the school systems, I think, as you might have heard, with individual colleges and universities on a protocol, and leaving it up to them how to handle the situation. Again, it doesn't seem to have gotten to the point where you heard doctors say that they're not even going to test anybody unless they've been out of the country. So it doesn't seem to have gotten to that level as yet. But it'll be interesting to see what happens, of course, when some of the students come back from overseas trips, Spring Hill bringing their group out of that. I don't know if they're all going to be coming back at one point, but they will be monitored, and that's something that will be closely watched. But it doesn't seem to have gotten to the point interesting little efforts. We've heard a lot about community transmission, and that's sort of a nebulous area because there have been some cases, and I think if I read correctly, there's an area in Tampa, Florida, where there were 2 at least presumptive positives, if not actual positives. So community transmission, meaning no direct connection between anybody who's gone to China or anywhere else back to another person. Where is that and where did it come from? And that's going to be something you're going to have to watch on the national level because, again, this is just developing on a local level, and as well prepared as everybody is on the local level, it is a developing situation all around the country as well.
Any concerns in reference to spring break about to begin at Alabama's 2 beaches and, of course, folks coming in from all across the country?
Not have heard of any, but that might be a good question for Gulf Shores Police Department, Orange Beach Police Department, any issues there, the hospitals down there. Again, I think that since there have not been any confirmed cases or any even presumptive positives here in Mobile, it hasn't gotten to that level. But anytime you get into a place where you've got a lot of people, there's more concern for flu transmissions at this point at spring break or anything along those lines than there would be about coronavirus.
Steve, thank you. Great job. Anything else you want to close out with?
No, just continue to keep monitoring Fox 10 News. This is a situation that is changing almost every 15 minutes or half an hour. I'm monitoring the situation, and you find new developments all across the world, literally almost every half hour to hour. So this is something that you are going to stay tuned to fox10tv.com news now, because you never do know whether that could be a breakthrough or a new development sometime happening really within the hour.
All right, Steve, thank you very much. Steve Alexander reporting live for us there at the Mobile County Emergency Management Agency, and they have the news conference today along with the Mobile County Health Department. We're here on Fox 10 News now, and of course, as Steve mentioned, we'll have more information for you throughout the day here, as well as starting at 4 o'clock, our Fox 10 News at 4 p.m. on Fox 10 WALA TV. So we thank you for joining us this morning, and of course, stay posted for continuing education and information on the coronavirus.